The shoulder is a ball and socket joint. It's a complex joint that is surrounded by tendons and muscles. The shoulder itself is surrounded by the rotator cuff muscles, which is a group of muscles that start on the shoulder blade, with one at the front and three either at the top or the back of the shoulder that come and surround the joint itself to give the shoulder joint its stability, but also power its strength and movement. In shoulder arthritis, there is a problem with the cartilage surfaces of the ball and socket joint. And the important consideration is whether or not this rotator cuff tendons and muscles are intact to work out what management options are available. The common symptoms that occur when you have shoulder arthritis include pain, which is often felt at the front or the outer aspect of the arm and shoulder itself. With pain that can often affect sleeping patterns and can wake you up at night, comes loss of function, loss of range of movement, and difficulty with most activities of daily living. The treatment of shoulder arthritis is to firstly optimise all non-operative options. These options include activity modification and to prevent activities that cause more shoulder pain, to try simple analgesic options and tablets that reduce your pain and help you sleep, and then attending to physiotherapy and having exercises that stabilise and strengthen your shoulder to try to overcome that pain from the loss of the cartilage. If surgery is indicated and you require a shoulder replacement, we can have further discussions during your consultation with me. The shoulder is a ball and socket joint, and if the rotator cuff tendons are intact, you can replace the ball and socket with a new ball and socket joint. The socket, which is called the glenoid, is often replaced with a plastic insert that is cemented into the socket, and the arm bone or the humerus, the top part of it is removed by a saw which has arthritis. A new stem is introduced and a ball is then replaced. This means that the ball and socket is replaced with a similar prosthesis which will completely take away the pain from bone rubbing on bone, and the surrounding soft tissues and rotator cuff, which is intact, once you've done your rehabilitation, will help strengthen and move the shoulder completely. In patients that have a deficiency or a tear of the rotator cuff, the ball and socket joint cannot be replaced with a ball and socket, but a reverse shoulder replacement is then performed. To explain that further, instead of a cup being inserted on the glenoid or the socket side, this side is instead replaced with a ball, so it's reversed. In this operation, I put a metal component on the socket and place a ball on the socket, and the arm bone and the bit that is arthritic is removed. The stem is inserted into the canal, and instead of a ball being placed, a cup is placed on the arm bone. This then means that you have a reversed component, which is the opposite of an anatomic shoulder replacement, but does not require the rotator cuff to be intact to move this arm. The shoulder replacement takes approximately an hour or two to perform. You'll be admitted to the hospital, and after the operation is performed, you will need to stay at least the first 24 hours on one of our inpatient wards. During your stay, we'll ensure that you're comfortable and you have enough pain relief, as well as administering antibiotics for the first 24 hours to prevent infection. After your operation, I put an occlusive waterproof dressing over your incision, which should be kept intact for 2 weeks. Your arm will also be placed into a sling, which should be used for the first 4 weeks. A physiotherapist, however, will see you while you're in the hospital to start early range of movement, as with more movement and exercises, the better range of movement and function you'll have from your shoulder replacement. Over time, there is a chance of wear and tear of the shoulder, given that the bearing surfaces include both metal and plastic. This is observed by having regular follow-up with me in the post-operative phase, where we ensure that your range of movement is maintained, that your shoulder is comfortable, and perform regular x-rays. If wear and tear does occur, this should occur many years after the index operation and may lead to the fact that you require further operations in the future.